choosing your surgeon is the most important thing that you have to choose right, okay? To do right, actually, when you undergo rhinoplasty, okay? Choosing the right surgeon will choose the right procedure for you, the right implant, the right place where you're gonna do the surgery, okay? So be sure that your surgeon is very experienced, okay? Try to do your due diligence. Don't be impressed by before and after pictures, okay? Talk to the surgeon, okay? An ideal surgeon is somebody you can easily talk to, who will answer all your questions all the time, okay? Not just rely on somebody else to answer the questions. And then, because if you cannot talk to the surgeon before the surgery, don't expect that surgeon to talk to you after the surgery, okay? I'm sure you will have more questions after the surgery. So a good surgeon is somebody who does not only how to do the surgery, but somebody you can talk to easily, okay? Of course, getting a second or third opinion is the best because you can compare your surgeons, okay? Again, don't be impressed by before and after, because who knows if he's the one who did that before and after pictures. Who knows if the before and after pictures were not photoshopped, okay, just to. So it helps, but the best thing to do is talk to your surgeon, okay? Don't ever have somebody else talk to you and somebody else do the surgery on you, okay? The one who talks to you, explains to you, should be the one to do the surgery, okay? And should be the one also to take care of you after surgery. Okay, is there an age limit for surgery? Again, it's the parental consent. The youngest patient I had was 14 years old, okay? But usually, because the child has grown big enough already, no? That they have achieved their potential growth height and width and the growth of the face, okay? So, but usually for males, it's like 16 years old, 17 years old for males and 15 years old for females. There's no age limit as long as the patient is healthy. The oldest patient I had who requested for rhinoplasty was 64 years old, okay? So as long as the patient is healthy and the need for rhinoplasty is real and reasonable, okay? There's no age limit to when you can do rhinoplasties. No surgery is a straightforward surgery, local anesthesia, so usually you don't need any preparation. In very few cases wherein the patient would request for sedation or to be under anesthesia, then we usually do the usual laboratories and cardio clearance, okay? But basically, preparation for rhinoplasty is not that much as compared to like breast augmentation or other surgeries wherein the patients are put to sleep, okay? The most important thing to do is know what you really want, okay? Because you don't allow the surgeon to decide for you what is best for you. You're the only one who knows what is a proper nose. The surgeon can only suggest and make sure that what you want is safe for you, for a lifetime safe, okay? But again, the surgeon should follow what you want, okay? So that's the best way to prepare yourself. Know exactly what you want, okay? You can show your surgeon pictures of other people's noses so that he will have an idea what type of nose you like, okay? And the surgeon should be honest enough if he can produce that or not, okay? Rhinoplasty is just like any other surgery. There are complications. Bleeding is not one of them, but infection is, especially because we're using implants, okay? So make sure that the surgeon's clinic is sterile, and you can do that by asking if for a Department of Health DOH certification, if they're certified to do plastic surgery or not, okay? Those are just few questions you can ask your surgeon, okay? And they should be able to show you a certificate of accreditation, okay? Because that means the place is sterile enough for surgery to happen, okay? So, of course, the doctor should also have a good technique to prevent infection, okay? Now, other complications of rhinoplasty is a deviated implant, which can happen to anybody, okay? And usually, it's usually the fault of the surgeon. The pocket is not in the midline, the implant will go there. But unfortunately, some surgeons would actually blame the patient that if it's deviated, it's because you hit it on one side, you didn't know about it, but so that usually that's not true, okay? Other complications, or I would say the most common complaints of patients, not really a complication, is that they were not able to get what they want because they were sedated when the surgery was done. When they woke up, they would find a big nose bigger than what they wanted. So again, discuss thoroughly with your surgeon, okay, what you really want, and it's best if you can see, or the doctor will show you the changes that is for your approval. Okay, this is a very good question. Which is better, silicone, cartilage, gore-tex, okay? It varies from patient to patient, okay? A good doctor should not insist on one kind of implant because it's the only implant he knows how to do, okay? The good doctor should be able to explain to the patient why silicone is better, gore-tex is better, or cartilage is better. Because sometimes there are noses that doesn't need any implant at all. So you have to discuss this thoroughly. What are the advantages, disadvantages, okay? Silicone has been with us since 1970s. Gore-tex has been with us since 30 years ago. Complications now of both implants are now better known. And let your doctor explain to you exactly what are the complications, what are the possible complications for each before you decide what type of implant is needed and best for a particular nose, okay? Most patients actually go back to work or have some pictorial in their models after about a week after rhinoplasty. Of course, these are most patients, but sometimes there are some who had a previous surgery before, who had injections of silicone, their rhinoplasty becomes a little bit more complicated. They might need more time for healing to go back to social activities or back to work, okay? But usually, it's about a week, okay? When can the patient travel back or fly? Okay, usually it's about a week also. Okay. When can the patient resume physical activities? For me, I would ask the patient to at least have about 2 weeks before they can really go to strenuous physical activities like contact sports, scuba diving for rhinoplasty. Okay, but I tell them, play it by ear. If you think you're healed enough, then it's safe for you. Because when you suture the wound during a rhinoplasty, that is sealed off in the first 24 hours actually. So I allow my patients to shower, wet the area, as long as they dry it up right away. But again, contact sports, maybe about 10 days to 2 weeks. What is revision rhinoplasty or secondary rhinoplasty? If you had a rhinoplasty before and you're not happy with the results, or it got complicated, and you have another surgery, that's called revision rhinoplasty. Now, revision rhinoplasty is usually more difficult compared to doing a rhinoplasty on a virgin nose, because for one, okay, you have scar tissue there already. If the patient was done by another surgeon, we usually advise them to go back to the surgeon, but most of the patients don't like anymore because they've lost trust in the doctor. So now when you accept the patient, you have to assume all the mistakes of the previous doctor, so that makes it difficult. That's why revision rhinoplasty is not only more difficult, but usually it's a little bit more expensive compared to a standard rhinoplasty. So now, when you have revision rhinoplasty, not all of butt-up noses can be corrected 100%. And so the doctor usually tones down the expectations of the patient by telling them, okay, we'll try to correct. Sometimes we correct it 100% to your satisfaction, but sometimes we can do only so much. So when you have revision rhinoplasty, bear this in mind. It cannot be usually compared to a virgin nose or a first-time rhinoplasty. This is the reason why we always advise the patients to choose their doctor very, very well, okay? Because the best results are achieved during the first surgery, Revisions are just salvage procedures. Very important also, patients cannot wait. That's why I'm wondering up to now why they're called patients. Most of them are very impatient. No? When they don't like the results, they want it done right away. We wait for at least 3 months. No? What do we wait for? We wait for the scars to mature, soften, let the healing improve the area further, okay? Because if you don't wait and the area is still swollen, inflamed, no? And you cut, number one, it's more bloody. It's very difficult to produce the results that we like. Unpredictable, the healing is quite unpredictable. And of course, like for example, if it's infected and the patient wants to put in a new implant, you cannot do that. You have to wait for a certain period of time to make sure that the infection is totally healed. Otherwise, you put an implant, the patient will come back with a swollen nose. So for revisions, okay, it's case to case, okay? But usually, the longer you wait, the interval between surgery, the better the results.